that garbage right there. Put it over here. When you do these skills, you want to have your garbage here, and we're ready to go. I'm going to open my container here. This is a red bag. It's going to go into the soil utility room when I'm finished. I'm going to pre-measure my tapes and tack them right here. Two long ones and two that are about 5 inches long. And one for my signature, 2 inches long. Two long ones, two shorter ones, and I'm going to open this. This is supposed to be saline. It happens, what we have in the lab here is water. Now I'm going to take off the dressing. And you drape the patient, obviously, down here. You're not going to have him open, have him for comfort and warmth.
So this is sterile?
Not yet.
No.
No. Not. I'm gonna put it on sterile for when he's open. My sterile field is not open yet, so I'm moving away. These are the gloves I was telling you that come out of your kit, and I'm going to use a medium. Okay, so now we're ready to go. Have they taken the test?
Yeah, we all did. That's why we're here, because it's quick.
Oh, it was. It was how many questions? 20. All right. Before you go yanking something out that's crucial, like a drain, I'm going to, remind me to show you a drain that's over there on another mannequin. I'm going to take a look and see what I got underneath here. I don't want to go yanking everything off. It's just a plain, thank you, it's just a plain dressing. So I'm going to pull it off the rest of the way, put it in there. And what do you think the wound looks like? Is the stitches intact?
Yes.
Yes. Is the wound together?
Yes.
That's called approximated. Is there redness?
Yes.
Yes, and that's the inflammatory process. So this is normal, a normal healing wound. So now I'm getting rid of these. Right. No. And you look at the dressing as well. When you look at it this way, I see just a few spots of blood. Now, this is, I'm going to just put a little bit of water on it, then I'm going to get sterile and I'm going to tap it dry. Now, this is if you go over here and squirt it, it's hard to push. So you'll go, and you'll scare him and scare you. So you want to squeeze it just a bit to get that first bit going. Okay, that's plenty. This is going to go Sharps container when I'm done. And now I'm going to get ready to glove up. And you don't have to treat this part of it you don't have to go. Okay, just get it out. Put it right there. And then we're going to open our 4x4s. And we don't want to tear it, so start in the corner, come across like this, and open till you get it fairly wide. If you drop it on the floor, that one's no good. The 5-second rule does not count for dressings. So have extra stuff in your pocket, an extra pair of gloves in case you contaminate yourself. You can tell me during testing, well, I can't use that one because it fell on the table. One of these is going to be for tapping the wound dry. The other two are going to be placed on the wound, and this is going to go on top. Okay, now we're ready to go with this. When you see the word cuff in, it goes to the bottom. And The gloves are inside this, like Madonna, like a prayer. Okay, thumbs are out, up like this. So you can open it out like this, but then you've made a field. So I'm going to simply do the trapdoor method. You only handle these leaflets by touching this part. So I'm opening it up and I can touch anything here. So I'm going to pull it up and out. Okay, and I can touch anywhere in here because that's going to lay down against my wrist. And if you drop the glove at this point, it's contaminated. So this one's going on fairly nicely. It's not rolling back here. And you just simply want to get it on slowly and then pull this down and don't fuss with it anymore. Bare hand goes to this leaflet. Now hold on to it. Don't let it follow around like this because you're going to have to take the 4 fingers and you're going to place them. I can touch anywhere in here, but I can't go off this by an inch. So I got my 4 fingers in here. And then, like you did the swoop and scoop, this is the thing you need to remember, hitchhiker thumb. Okay, so hitchhiking, wiggle, wiggle, wiggle. If you get the fingers in the wrong place, like I have right now, and you can correct it after you get the glove on. Like, let me just do it like this. I got 2 fingers in the index, but I can touch now. So on the second glove, if you do it on the first glove and on the wet to dry dressing, you have to do the whole thing with this finger loose, with nothing in it, okay? Now, I want to go up underneath here and grab my 4x4, make a fluff, and I'm going to go down the incision. I'm not trying to disrupt any sutures, and then I'm going to go outward a little bit more.
So you dab.
You
dab
dab.
the incision and rub the skin.
Right. And then there it goes, and then we go in there and retrieve this. And now we're at Subway making our Subway sandwich, putting the bologna or provolone, whatever it is. Blue side goes out, dressing's in place, gloves come off, and you're going to have to learn how to repack your gloves so you can practice the skill at home because you're going to be using your kit over and over and over again. Barehanded we can do our tape because it's virtually impossible to do tape with gloves on sometimes.
You would normally do a skin prep before the tape, right?
You can use skin prep, yes.
Unless they need a wax.
Hopefully, if they've done his chest, if they've done a cabbage, coronary artery bypass graft, they've shaved his chest. Okay, I need a pen. 11, 13, 13.
10:47.
You don't have to be so exact. 10:45 is good enough. An initial.
Still used to the math class. You know you have to turn around.
Yeah. We just want to know what time it was done so that the next day we're going to do it again. This is wrapped up and taken. We're going to take this out and put it into the sharps container. And then the rest of this goes into the red bag. Same thing. This is going to go in here. And then this goes in the garbage. This goes into sharps. We tie it with the tie. You're going to document, wash your hands, skill is over. So now to reestablish your gloves so you can practice again, you really need to get a little bit of talcum. And don't do this in clinical. Okay, I had a student do that once. I said, what are you doing? I saw you do in the lab. I said, I'm recycling gloves. I'm recycling the gloves. Put that, and I just in the sharps containers right behind you. Okay, that's the dry dressing. Remember, thumb side goes out. So remember to inside out your gloves again once you're done. Like that move? Okay, don't put too much stuff where you have powder all over your house. Okay. Okay, this is left side glove. Looks like right side. I want to show you the difference between the Toyota gloves, or the Ford Focus, and the Cadillac gloves.
Ain't nothing wrong with Ford Focus. Did I just not record that? That would be so obnoxious. There's like 17 other people recording, don't worry.
Yeah, and this morning as well. We're recycling these as well, so don't look.
Hood Hospital. I'm so good. I'll reuse my things. I have patience.
I was telling my trainer last night, I think I'm gonna give back my Lexus after my lease is done and get a Honda or a Toyota, buy one. She said, how could you go back to a Honda or a Toyota after a Lexus?
Get a Toyota Prius. The Prius, I'm telling you.
A what?
My Prius, the best decision I ever made. And I had an Acura before. It is so good. I spend, and I drive a lot, like more than 1,000 miles a month. I spend only like 60, 70 bucks a month on gas.
I spend that a week.
Oh wow.
I'm telling you, it's worth it. Total advocate for tree hugging.
Well,
Yeah, well, this Civic is like
anything to do with the Lexus is that the insurance is expensive because it's considered to be it's a luxury sports car. So they hammer you with the repairs, and it's a $41,000 car, so it was.
But it's nice.
Oh, I know it's nice, but the police like it too. It's just,
I spent
car,
like 90 in my
her
little
Lexus.
Prius. No one stopped me.
They stole my car all the time.
It's because they don't hear it
I
coming.
have a GTI. So I was like, oh, there's a man in there who's about to race.
They always stop me too. Because I have the smoked windows and this.
Yeah, you look like a little gangster in there. What about me when I'm in the Charger? I'm like drug dealing.
Yeah, you do. All right, this is the Cadillac. We're taking it out of. It's powder-free latex surgical gloves. Now, if you're allergic to latex, you can't take this
Yeah.
because you get sores all over your hands. Yeah. Crystal, are you allergic today?
The white tape, but
I mean, are you allergic to latex?
no, they can.
Okay. Powder-free latex gloves. Now, remember, you can only touch the tabs here. You don't open it this way. You always open it from here. So I'm going to open it. And it doesn't really matter whether you're dominant hand, if you're right-handed or left. I think I can do just about anything with both hands. Well, I mean, with like a forceps or a scissors. Wrong skill. Okay, right here. Take this out. Get your minds out of the gutter, girls.
It had nothing to do with you.
Oh, it's Megan. Oh,
It had nothing to do with you. I rubbed. You thought that way.
Is on fire.
Now notice how
Also red.
I'm pulling this. When does Catching Fire come out?
Like in the last week of November.
Oh,
I'm so counting
I
down.
can't wait.
Let's
I
all
read the book and
go.
it's
Okay. And then, yeah, really. And now I'm gonna pull down. Let me get my rubber on, would you? Okay, now I'm gonna move. Now, don't let this move around. You can put the glove anywhere, but you don't want to slide it off. And so you're gonna put your 4 fingers in here, close the hatch, and then don't put your finger down. That's most the hitchhiker finger. And you want to come out and kind of ease your fingers in. The thumb, it looks like you're not on the right side with the thumb, but you are. And there you go. Look how nice it fits. Now it rolled a bit, so you're not going to go back and fix that. You're good to go like that. You have more dexterity when you have a glove that fits. Not the little
Are
cheapy
the
glove.
ones in the packet latex?
Cheapy. Well, if it is, then